All right, everybody, Mark Crowley here, and we are at the Health Fair 2010, and we've had so many great people in and out throughout the day, low cost, no cost health screenings, a lot of great vendors here who are all focused on health. Everyone knows that the Denver community is a very active, has a healthy mindset, and there are a couple of areas that sometimes maybe they're overlooked, and one of those is our dental health. And what we have is an opportunity here at the Health Fair today to do free dental screenings. And joining me is Dr. Larry O'Neill, and you're the guy in charge of doing those screenings today. Talk a little bit about why you chose to be here today and some of the issues that you see in the area of prevention in dentistry and how that's evolved over the years.
Well, Mark, this is our second year here at the KNUS Health Fair, and we like to come out here because it's a chance for us to give back a little bit to the community. We've done in the neighborhood of 40 or 45 screening examinations today. Of course, we don't have x-rays or anything like that, but we're doing caries check for cavities. We're doing a gum evaluation. We're doing an oral cancer screening. We're answering patients' questions about treatment needs they may have, about questions about technology. We have a video on display that shows some of the technology we have in the clinic, including laser, water-lased lasers, bio-lased lasers, CEREC, which is a CAD-CAM milling system to mill crowns. So a crown visit is 2 hours, no return, done. Digital x-ray, and Invisalign orthodontics. So all of these things enable us to do better prevention because many things enable us to do smaller things earlier with no anesthetic. People don't get scared so much by the prospect of coming in. And we pride ourselves on having a very healthy and happy practice.
You know, one of the things I think that I've heard over the years is the fact that dentistry in particular has become so good in the area of prevention that there was maybe a fear for a while that doctors or dentists were going to prevent themselves out of business, but that really isn't the case. So it's an evolution. Things are different today, but prevention is still the key.
Prevention is the key. In fact, dentistry in the medical world has led the whole medical world in the success of prevention. With our preventive policies, the advent of fluoride, the understanding of what causes dental disease, we have been able to take the average person who's born and grows up in a good practice from a child who's scared to death to come to the dentist, has cavities and has just lots of pain and discomfort, to kids that enter high school and never had a filling. And I find that personally in my practice life to be extremely gratifying.
I'm just thinking back. I have not missed a 6-month dental checkup since about 1989, and I got to tell you, doctor, that I'm so grateful that I had a dentist in my life who was focused on that and was caring enough and made the visit inviting enough that I wanted to come back, and I just turned 50, a little over 50 now, and my dental health is something that I'm very proud of, and I think it's because I lived a life of prevention.
You're exactly right. When I first entered the practice of dentistry years ago, there were a lot of people who are my age now that were in dentures or going that way, and that was kind of the graveyard of dentistry at that point in time. Nowadays, very few people in the geriatric world are into dentures, and if they are into dentures, there's so many ways to make dentures better with mini implants, full implants, ways to anchor dentures down and make them much more usable and user-friendly.
How can people reach you if they weren't able to come to the health fair today? They're listening to this show a little bit later on. What's the best way to reach you?
By phone at 303-841-7466. We're on Facebook at Twin Aspen Dental Center. Let's see, and we're online, twinaspendentalcenter.com.
Well, very good. Thank you for being with us. I know you got patients to get back to, so I appreciate it very much.
Thanks, Mark.
Thank you.